Okay, I've got one past the hour, so let's get started. Welcome you to the weekly LeadingAge Texas COVID call. We've been doing this for a number of weeks now and continue to get a lot of strong interest from our members. I do want a couple of reminders. A week from Thursday, we will have our virtual conference the same week as we would have had our normal conference, and that's going to be again next Thursday, and we'll post the link right on our chat feature here. I want to make sure you all get registered for that. There is some CE credit that it comes along with that, so I want to make sure you get registered for that. Today we're going to have presentations from our friends Ed Ziegler, Rich Scanlon, and Brandon Powell, who will talk to us about what's going on in senior living around the country, followed by an update of what's happening in Texas from Elise, who will talk to us about what's happening with the latest governor's order on testing, as well as a lot of other issues that we're dealing with. We'll have some other updates as well, a PPE update and some other updates as well. So with that being said, I'm going to ask Rich and Brandon to give us a presentation. Both of them have been in the senior living field for a long time and are really good friends of LeadingAge Texas. They're partner level sponsors, and we appreciate all the support they give us throughout the year. And particularly want to thank them for coming on today and giving us a presentation of what is happening in senior living. Following the presentation, we'll have a Q&A. Again, as it's worked in the past, we ask you to possibly ask your questions in the chat feature. And we will open it up if people have questions they want to ask online, but probably the easiest way is just to ask your question through the chat feature. So, Brandon, are we ready to go? Make sure, are you on mute?
Yeah, good point. Thanks for the reminder there. I am ready to go. Good afternoon, everyone. I am sharing my screen with you so everybody hopefully can see cover page of a not-for-profit senior living sector update. George, thanks for the introduction. Rich Scanlon is going to try and join us. He's double booked here, but obviously Rich and myself value our relationship with LeadingAge Texas and all of our provider clients, prospects, and just the entire sector. So I'm going to try and make my comments, restrict them to 10 minutes or so, which may be a little bit difficult for those who know me. I'm a little chatty. Just know that these slides are available. Be happy to, I'm sharing my screen, but LeadingAge Texas has them. I don't know if they'll post them to the website. You can also shoot me an email, and I'd be happy to share slides with you. But really, since this has started, Ziegler wants to serve as a resource to you. We've held multiple webinars and conference calls with a variety of folks. Our next webinar is going to be later this week on the 14th for our clients and hosted really by Ziegler, but we've had some of the larger, more well-known individuals within this sector, Katie Sloan, John Spooner, Lisa Laguerre from Glen Devon. So these have been for providers, they've been for investors to senior living who buy bonds, banks, et cetera, and providing a bunch of resources. We do have a website, a special section of our website dedicated to COVID-19, which I'll end my comments on. You can get more information or some of the information that you see here, but really tracking the data and what we're seeing out there. We love data at Ziegler. And so Lisa McCracken, our head of research, has an exhaustive database of where the confirmed cases are. Yes, we are scouring every community's website. We are scouring the state data warehouses, and we're scouring just the news links. And so you can see the purple bars are national stats. The aqua bars are state of Texas for, yes, at least one confirmed case. explicit no, and then unknown. Just to give you a sense, the percentages pretty much track each other nationally and Texas. 24% and 20% for yes, at least one known case, 17% and 24% for an explicit no, and then 48% of communities nationwide and 41% of communities in Texas with an unknown. So that's where the data stands today. This was as of yesterday, but it's going to evolve like everything dealing with COVID, and that'll be a common theme within my comments. Another number of cases, and this is just nationally, we don't have the data for Texas, but you can see less than 10 cases is the overwhelming majority, 76%. Obviously, there are a few horror cases, out there, but as we all know, those are restricted to nursing homes, not really life plan communities. So I know that we have some non-life plan communities on the line here today, but we focused this data on life plan communities. Roughly 3% of the organizations have had more than 50 cases, Lambeth House being one of the bigger ones, and one out in the Pacific Northwest as well. So you can see where the number of cases range. But really getting into the data and breaking it up, one thing that's been very important and a big pressure point to all of you is staffing. And we talked about it before COVID. Just unemployment was very low before COVID. Wages were going up, and you had to deal with Amazon and Walmart and other large organizations competing for staff. But now, more than ever, you have to deal with this, and there are other benefits out there that are going to be more important. You can see the other benefits that folks are offering or that may be out there. Clearly, hazard pay, wages are important, but childcare, other benefits, working from home, flex schedules for manager positions, and what can you do there? Unemployment right now is at unsustainable highs, 15% nationally. That gives you an opportunity to get staff. So the staff that you were unable to obtain pre-COVID, hopefully many of you organizations can get that staff on payroll today, because I do believe it's an opportunity within the entire sector. One important thing out there is the PPP, the Payroll Protection Program. All of you probably know about this. I'm not going to get into details as to what the program is or what it's about, but really the bottom half of the page, because I think that's what's most important. And that first sub-bullet, I'm going to read it in its entirety. Borrowers should review carefully the required certification that, quote, current economic uncertainty makes this loan request necessary to support the ongoing operations of the applicant. Okay, that's very important. This language would appear to have broad application, but, especially given our current economic climate. However, we would urge all of you to contact your legal counsel to obtain recommendations as to whether or not you should keep or repay your PPP monies. We are hosting a database at Ziegler where we know we're tracking around 120, 125 not-for-profit life plan communities. Of those, we do know 7 have either repaid or pulled their application for that loan. But it's the SBA and the government is supposed to provide us guidelines on the repayment and what that certification really requires. The safe harbor expires May 14th. However, those guidelines have not been provided yet. So our expectation at Ziegler is that you're likely going to see an extension to that. However, at this point in time, there has not been one, but we'll see how this evolves. I know that a number of organizations here really need this PPP money. Some maybe not so much. Maybe some do. There are a lot of opinions on this. Some believe it is really restricted to public companies versus private companies. But consulting your CPA and your legal counsel is going to be very important. I know Corey McDonald's on the line, so he may have some comments on that later within this call. What pressures are we seeing other than staffing? I started with staffing, but we're seeing a lot of adaptation. I mean, you've got new campuses, you got campuses that are expanding, considering expansions. So what is it doing to marketing of the units? We just don't know yet. We know a lot of you are doing virtual sales. Those seem to be fairly effective. We know of a few communities in Texas that are doing those on a pre-sale basis for expansion projects. However, we're really going to see, over the course of the next 60 to 90 days, how impactful they are. Ultimately, the marketing firms want to get to face-to-face marketing. We don't expect significant withdrawals on the debt service reserve funds and payments of trustees and massive defaults as a result of COVID. There are organizations out there that were troubled financially, less so in Texas, but in other parts of the country that were troubled. COVID is really, it may be the straw that breaks the camel's back, but nobody has really hit the financial skids because of COVID. Everybody that was tracking down a negative path was already headed that way. So we believe the financial health of the sector is as good as it has been. There are going to be some rocky times ahead. We recognize that your nursing homes and your AL facilities may not have the admissions because of the hips and the knee replacements, et cetera, but that should normalize here over the long term. We are monitoring a number of covenants: the temporary debt, the short-term debt, the entrance fee debt. Those are all synonyms. Debt that's going to be retired with those initial entrance fees. So your marketing covenants, your occupancy covenants. CCOL stands for cumulative cash operating loss. We're monitoring all of those three. There's some large new campuses out there, even in Texas. Ventana's probably the most recent one that we're tracking. And then long-term debt. Many of you have a debt service coverage ratio covenant and a liquidity covenant measured by days cash on hand. The PPP money should count towards your debt service coverage ratio. Be sure when you talk to your CPA that it's accounted as a contribution once your PPP loan is forgiven. But you definitely are going to want to talk to your CPA. There are a lot of you, work with CLA and a number of other accounting firms within a state. And if you haven't connected with them, I would definitely urge you to do so. Topics that we're having with investors. This is very important. Many of you post to Emma, the National Repository website. Most of you have your quarterly disclosure, your annual disclosure, and that's in the middle: the sales, occupancy, new projects, financial. But I think one thing that's important, while it's not required, it's a best practice, is are you going to submit anything to Emma or post to investors what you're doing to fight COVID? The strategies that you've put in place at your campus, closing the campus, locking it down, restricting visitors, delivering meals, whatever it may be at your campus. And then how many cases you've seen, how you're fighting those cases. I don't think that these disclosures don't need to be made weekly or monthly, but if you haven't made one, you may want to consider to do so, to make one. You could, make one every, one now, and then the next one would be during your quarterly disclosure for the quarter ended June 30th, which that disclosure will be made by August 15th for many of you. Clearly, your other disclosures are out there. The PPP program, very important. At the bottom of the page, that you make a disclosure to investors that you've, applied for funding, and how much you've applied for and the timing of that. You also need to, most of you can meet the additional debt test to take that PPP money as well. So you're just going to want to notify investors as, that what you're moving forward with. So now I'm going to switch a little bit to the market and interest rates, everybody's favorite topic. And what you see here is municipal bond inflows and outflows. So when we sell bonds to investors at Ziegler and our other peer firms, we're selling to Nuveen and T. Rowe Price, Vanguard, these large mutual funds. And those mutual funds receive money from mom and pop investors like everybody on this phone call. Well, when COVID started, there were massive redemptions in bond funds. You can see those red lines. We believe these red lines are actually understated and the redemptions were higher. But you can see redemptions were the highest they've ever been, in the history. Even last week, we saw about $1 billion leave the marketplace. So we track that every week. And the reason why we track it is because it's a supply and demand market. The less money there is, the less there is to invest. The more money is, the more there is to invest. So more money, lower interest rates. You can see that interest rates have spiked here. Sorry for all of the lines and numbers at the bottom page, but this is interest rates over the last 10 years. The blue line at the top are non-rated interest rates for institutional. The red line is the triple B rated, and then the light blue line at the bottom is AAA MMD, which is the core AAA rated index. These are just indicative rates. You can see that the non-rated rate spiked up to 7%. It is coming down and normalizing, and it will continue to normalize over time. However, for all of those folks that got in and out of the market very quickly in the first quarter this year, I see one name in particular that did. Congratulations, because life would have been a lot worse if you had a bond transaction out in the marketplace right now. That's fixed rates, bank debt. Many of you have bank debt outstanding, and so this gives you a history over the last 40 years of bank debt, or 35 years rather. You can see that rates have trended down. The Fed has dropped short-term interest rates, which is LIBOR, the London Interbank Offering Rate. We do believe that LIBOR, all indications are that that's going to stay at a low rate for the next 18 months or so. So that's what tax-exempt and taxable bank debt is based on. So if you have bank debt, this is a good thing. We were in a historically low bank debt environment from 2009 to 2016, and it appears as though we're entering that exact same, actually lower than where we were during that time period. So with the bank rates being so low, the question becomes, Brandon, well, what's the bank lending environment like? Well, it varies by region. We're continuing to see deals get done. We're actually working on a bank transaction in Texas right now of size over 100 million, where the bank did not pull their term sheet. But banks are spread thin with the triple P loans. They are focused on their existing relationships. So you definitely want to focus on your existing relationship. If it's with Frost or BBVA Compass or Truist or Amegy or whomever it's with, you're going to want to ensure that you preserve that good relationship with them. But we do continue to believe that the banks are going to be out there lending to this marketplace. It's going to take time for them to get through their pipelines, but life plan communities are solid credits. Default rates are still low, and it's going to come back to us. And really with banks, it's really the most attractive form of capital in today's environment. I'm going to end my remarks before we get to questions. I started with the webinars we've done. You can see the website link on the bottom in the middle of this page. And all of you receive our Z News updates, our CFO hotlines, et cetera, et cetera. For those wondering, I do not know the status of our Finance and Strategy Conference. Right now, it is still on the calendar. However, we will provide updates to everyone as they become available. You know, given travel restrictions, shelter in place, things could change. But with that, George, I'll hand it back over to you, and I'd be happy to answer any questions.
Thank you, Brandon. Great information. And yeah, if you have questions, please sure to type them into the chat box. I do have a couple of questions that you may or may not know the answers to. Wondering if you've heard of any communities. You mentioned about recruiting when there's so much unemployment. Have you heard of any communities that are really doing a bang-up job at that, really sort of models for getting the recruiting cycle, you know, really ramped up so they could fill positions?
I have not. I can ask Lisa McCracken, our head of research, to see if we can get any data points on that. I did see something. I live in Richmond, Virginia, coincidentally enough, and I was riding my bike with my daughters, and a bus passed me, city bus, and the city bus was shrink wrapped with Westminster Canterbury Richmond, which is a big life plan community here in Richmond. But they were advertising for employees on a shrink wrapped bus, which I thought was unique.
Okay, good. Well, whatever works, right? Also, you mentioned more of the virtual selling of units. Do you see that as becoming the new norm, you know, moving forward?
I think it's going to be, I don't think it's going to be the new norm. I think it's another tool that organizations can use. Right now, it's the norm, But I do envision, when somebody wants to move into a CCRC, usually it's multiple touch points over multiple times. So I think you're going to see some Zoom meetings, go-to meetings, whatever it may be. But ultimately, I do believe you're going to get back to, folks coming to a marketing office, looking at the floor plans, looking at the layout, with the big model. But I do believe that will come back ultimately. It's just a question of, when sheltering in place orders, are limited, when there's a vaccine, when people feel comfortable out driving. It's going to be a mixed bag here in the short term, but I think long term you'll get back to a more regularized marketing structure.
Okay.
Brandon, I have a question, if you don't mind, George. Is that all right? Just kind of getting back to the PPP program. One thing that I've thought in kind of talking to folks about this and how they make that analysis of, whether they're able to certify that current economic uncertainty makes the loan request necessary. One thought I have is just that kind of performance in the short to medium term in terms of new admissions and residents would be an element of that analysis. Without speaking to specific without speaking about specific organizations, I guess what I'm just wondering as a practitioner is if you think it's sort of a reasonable assumption that there will be a general, downward trend in revenue throughout the industry, to some extent, to an extent that could justify that as a basis for keeping the PPP loan.
Oh, there absolutely is going to be impact to everybody's financial performance, without a shadow of a doubt. What I don't know and what nobody knows is what's the SBA and Uncle Sam thinking.
Right.
I've heard, I see both sides of the argument. I had somebody tell me, well, look, we could have fired employees, but we chose not to fire employees because we got the PPP money. I don't need 50 people in my dining staff to deliver meals to my residents. Nobody's coming to my dining room anymore. I'm delivering them. I could have had 10 employees. That's a valid argument. It's just very tough and it's unfortunate. I recognize the PPP program and why it was put in place, but there really needs to be some guidelines from the government so folks can understand. What we're recommending at Ziegler and what we've heard mostly from other professional firms is, wait for the guidelines to come out prior to, deciding to repay it. But if you take an ultra conservative view of it, repaying it is something that, should be considered.
Gotcha. Thank you.
Do we have some other questions from the audience? You can just unmute yourselves and ask. Okay. All right. Well, I don't see any more. If you still have questions, we can certainly forward them on to Brandon and get you the information you need. So thank you, Brandon, for spending the time with us and giving us such good information. This is a very strange time in our history, so it's good to know that there are some great resources out there for us. So, all right, I'm going to turn it over to Elise, who has some updates on what's going on with the state.
Hi, everyone. Want to provide a few updates from HHSC, regulatory, and CMS. Many of you have seen the CDC long-term care module reporting requirements, but I want to make sure everyone has had an opportunity to register for the portal, take a webinar, or view the resources for inputting your information into the module, and allow you to ask any questions on that reporting requirement. I believe the first submission is due on May the 17th, if that's right. I don't have the guidance in front of me, but we have that guidance on the resource page. I apologize if I'm incorrect in that date. But want to make sure everyone is abreast of those requirements. Also, HHSC within the last couple of hours just updated the nursing facility COVID-19 response plan. Those updates are highlighted in red. I had a chance to review. There are a few updates from the plan that was sent out on Friday, I believe. So you'll notice they're updating these plans frequently and sending them out frequently. So make sure you have the newest version in front of you. I believe it's version 2.8. Many of you have already been in touch with us with questions on the governor's directive to test all nursing facility residents and staff. We had initial meetings over conference call this morning with representatives of HHSC and the governor's office to discuss implementation of this plan. As of today, this directive is only applicable to nursing facilities. I know that there's been some chatter out there about this being extended to assisted living facilities, but as of today, there is no plan to extend it to assisted living facilities. We are working on recommendations, questions, concerns to share with the governor's office and HHSC in a formal letter in collaboration with the Texas Healthcare Association. Right now, unfortunately, there really are no additional details to share. What I want to emphasize to all of our providers is that this is not the responsibility of you yourself to implement and administer this testing immediately in response to the governor's order. This will be done at the direction of the state agencies. So in the coming days, we will be working with those state agencies to devise a plan that makes sense, that is most beneficial to our members and the residents you serve. And I also wanted to take this opportunity to ask that any concerns, questions, considerations that you'd like us to share be shared with us. You could add those to the chat, and we'll make sure we take inventory of those following the call. But just to highlight some of the initial concerns we're obviously supportive of the availability of testing and having testing readily available and more, more preventative testing taking place in nursing facilities. But we want to ensure that the state is well equipped to support this initiative. So we will be really focusing on the availability of testing and the ability of the state to provide rapid results of testing, as well as PPE. They'll need to consider the potential staffing shortages that may occur should buildings come back with large numbers of asymptomatic staff testing positive. Also, the ability of facilities to isolate and or cohort COVID positive residents when these test results come back. I think I mentioned PPE. We need to ensure that there is adequate PPE and that nursing facilities are provided really an abundance of PPE should any major outbreaks be identified through this type of testing. We want to ensure that it is not on the facilities to administer these tests, collect specimens, work with the labs to get these results back, but these efforts need to be supported by the state heavily. So these are some of the items that we're including in our communication. I do want to inform those who may have been contacted by HHSC regional offices today or their local ombudsman regarding this directive. Again, they have asked questions that may have gave you the perception that it is on you to implement this directive. I just want to make clear that that is not the case, and the agency's been notified that those communications are taking place and creating some concerns amongst providers, and they're attempting to communicate with their local and regional offices that they should not be communicating those types of messages to providers. I also want to note that we have more recently sent 2 formal communications to the governor's office and state agencies. One urging that all hospital patients be tested prior to discharge and prior to admission to a nursing facility. That goes for new admissions and readmissions of existing residents. I had a call with the governor's office today, and that ask is being discussed with the appropriate agencies. So I am hoping that we receive positive word, as we're still hearing some hospitals are lagging on testing prior to discharge to the nursing home. We've also heard from members across the state about multiple concerns related to surveyor visits. These concerns range from just communication by surveyors, surveyors not understanding the current guidelines, or be up to date rather on the requirements, concerns related to surveyors not having adequate PPE, just things like that we've been collecting and attempting to address with the agency. So that is another communication that we've sent out this week, and are working to encourage more consistency across the regions as surveyors enter buildings and conduct these infection control focused surveys or respond to confirmed COVID cases. Those are really the major updates I have. I'm looking at the chat box. Yes, we are aware that Dallas County has issued an order to require hospitals test prior to discharge to facilities. We're happy that's the case. We're hoping that, again, testing capacity is there to make that happen. So please keep us updated if you're in the Dallas area on how that's working.
Hey, Elise, I just want to mention something that we talked about in the call with the state this morning. Was it was mentioned that those communities or those nursing homes that have already done mass testing, and I know some already have, they had the rapid response teams in and then tested all the residents and staff. And sounds to me like those are going to be put at the bottom of the list in terms of testing because you've already done the testing. So we're advocating for more of a phased in approach. There's no way we can test 1,250 nursing homes in the state at the same time without creating a lot of staffing issues. There's still not clarity in terms of where the tests are going to come from, who is going to be doing the testing, and still a lot of unanswered questions. The agency basically heard about the governor's order at the same time we heard about it. So they're putting together a plan, and we're glad they're soliciting input from the associations in that plan. So more information to come in the coming days and weeks.
I see one comment related to already reaching out for testing. I will follow up on that and get information. And then I see a question related to what type of testing will be required. That is certainly a question we have included. We are not advocating that testing is done all at once, nor do we think the state actually has the ability to conduct testing in that manner based on what we know in terms of testing availability, PPE availability, but also lab capacity. So as George mentioned, we will be advocating that a more phased-in approach is taken. There'll be several considerations made. Has a facility already been tested? To what extent has a facility had testing? How long ago that testing took place? What is the level of risk for that facility, probably based on location, but also potentially infection control surveys that have already taken place. So there'll be multiple considerations made in prioritizing facilities. That is also a question. So somebody asked about the resident's right to refuse testing. That can also take place with staff. So that was something we brought up this morning and we'll be addressing. Our message was really, you know, the more informed we are, the more informed the provider community is in terms of details, the process, how this will take place step by step, the smoother it will go. So we are attempting to ask every question, to raise every potential concern and make sure those are addressed.
Let me just reiterate what Elise said earlier is we need your input in terms of your concerns about this testing. So either in the chat box, you can email Elise or I and just let us know your concerns about the whole process and even some suggestions on how to make it work better because the agency is open to hearing those things. So we're just compiling all those concerns and suggestions. So we want to make sure that you have an opportunity to send them our way.
There's a question here related to COVID positive facilities being designated. So that has been taking place across the state, but it's really been driven by the local public health departments in collaboration with HHSC and private facilities. We do know of several that have been designated across the state, but I am not sure exactly where they are. I know they tend to be in, you know, the larger metro areas. Travis County, Bexar County. I believe there may be 2 in the Dallas DFW area. So yes, that's also an issue that we've raised with regard to the potential isolation or cohorting of a large number of residents that come back positive.
Yeah, and I think the reasoning behind having a COVID positive facility is for those other facilities or communities that don't have the capability of isolating COVID on their campus. So if you have that capability, I know a question came up here about, you know, how it's a bad idea to transfer your residents, and I agree. If you have the capability of isolating them in a particular wing or floor or whatever, I think that's probably the best route to take. But there may be other facilities in the area that don't have the capability, and that's the reasoning behind separating out the COVID positive.
Yeah, so again, as you think of things, you can continue to post them in this chat, and we'll have access to the questions in this chat after this call. Or if you can send them directly to me, that would be fantastic. You can also just submit them as questions through the resource page. There's a link to submit questions, and I'll make sure I'm checking there to see if anything comes in.
And Cheryl, to your question, they're not talking about testing weekly. This is a one-time test. We're actually advocating for nursing facilities to get an additional supply of tests so that they can continue to screen after this initial snapshot view, because that's all it's really going to provide is a view of the entire state, basically, but it's only one point in time. We think that continual screening and contact tracing is really the only way we're going to get some handle on this. So your point is well taken. The test is only good for the time it's taken, and a day later somebody could be exposed. So we want to make sure that there's some continuing testing going on.
That's all I have. I know Corey is on the line. Is there anything from your end, Corey, you want to share?
Not necessarily. I mean, I think this is all good information. I see Marcia's question about the option, asking if there's an option to refuse if no COVID patients. And my thought on that is, it's like any other admission assessment. I mean, there hasn't been any specific guidance in Texas saying you have to, or that clearly states you can deny admission. So I think what the state would say is you have to assess your abilities to meet them and meet their needs and keep your residents safe and make an independent determination on that one.
Corey, as I'm looking at the question from Marcia, do we have the option to refuse if no COVID patients? I was reading that as, do we have the right to refuse testing at our facility?
Oh, okay.
Yeah, no, that's unlikely. I think the purpose is to test prior to that COVID positive trigger that is now initiating testing. Again, we did raise the issue of refusals on behalf of residents and or staff on this morning's call. So resident rights will come into play here, and that will have to be addressed, and HHSC regulatory is working through that. Staff and how you handle refusal by staff, based on the initial response we got from HHSC, is where facilities may have greater flexibility in determining what their policy is for staff to refuse a test. But we've been communicating with our counterparts in other states that have undergone the same directive, and it seems to be common practice for staff that refuse tests is that they cannot work until they test, but that also needs to be considered when talking about staff shortages. And then again, when staff test positive, there's discussion about the ability to allow those positive staff who may be asymptomatic to continue working, and under what criteria they may continue working if they are positive but asymptomatic, like perhaps on an isolation wing of the facility where they have no contact with negative residents or staff, or in a designated COVID positive facility.
Yeah, the only thing I would add is, and this may be something we bring up to the state, is if a facility has tested on their own, whether that will, and they can document that, whether that will suffice for the testing, rather than having, if I know some of our members, as I said, had the rapid response team in their buildings recently. So I don't know if residents want to go through that swabbing test twice in 2 weeks, or so anyway, I think it's a concern we need to raise with the state. If facilities have gone ahead and spent the money and done the testing on their own, whether there'd be some waiver for that, but that's to be determined.
Yeah, and I know that the guidance sent out from Austin to the regional directors this morning, as we shared, facilities were being contacted by HHSC, giving the impression that facilities were to undertake this initiative on their own. I believe a clarification went out. HHSC will be in touch with facilities in an attempt to gather their testing status. So they will be asking questions if they don't already have the information related to testing. Have you tested on your own? How long ago was it? So that they will be attempting to gather that information from facilities if they don't already have it, to inform prioritization for this initiative. So be ready for that phone call or communication if you haven't already received it.
And Elise, I would add to be ready for all the families. If you guys haven't already started getting inquiries from the families, they're going to start asking, when are you going to start testing the residents? And so you may, if you are doing a communication on your website, or if you have some sort of mass communication, go ahead and let them know that you're waiting for the health department or HHSC to initiate that testing, that it's not something the facility is doing.
Thanks, Michelle. That's a great point.
Okay, let's move on to the PPE update. Anne?
Yes, I wanted to let you know that an announcement went out earlier today, our weekly announcement. We have 2 new sources that are under contract, so the price point should be more competitive. One is ASP Global with isolation gowns and disposable masks. Standard Textile also has an offering for reusable gowns and masks. There is another supplier that is on those were 2 new offerings. There's another supplier, Johnston's, that we've already received a notice that they have exceeded their capacity, and that just went out. So I'm getting confirmation on that. That was on the update that went out as well. So if any of you are looking at Johnston's, we'll have some further information on that. But not to go through every supplier that we have available, but just to go on the categories that we have available. So obviously we have gowns, both reusable and disposable. We are working on additional sources for N95 masks. I know that several of you have reached out to me for that. We do have availability on that list for KN95, surgical masks, infrared thermometers, and hand sanitizer. And a couple of new pieces of information. There was an email that just went out today from Value First that many of you were interested in the infrared thermometers, or some sort of thermometer system that didn't require an employee to stand there and take temperatures. They do have an offering for a thermometer kiosk. So if you did not receive that email directly from Value First, reach out to me and I can provide that information if that's something that's of interest to you. And finally, I know there's been a lot of discussion around the COVID-19 testing, and there's a lot of questions still out there, but we did have a community that provided a source, a lab that currently has the capacity to do the testing. that we wanted to share with you. That is going to go out on a communication after this call. But again, this was before some of the questions came up. So George, I don't know if you want to comment on that, if we want to wait on that, but that communication will be going out after this call, George.
Well, I mean, the only comment I would make is whether this testing is just a one-time deal, as we mentioned, I think facilities are going to need to have some tests on hand, whether they're hiring a new employee, whether employees coming back from being off, they're going to continue to have to screen. And, you know, temperature taking and symptoms are, you know, we know there's a lot of asymptomatic folks out there. So I think having the test on hand, at least an adequate supply for, you know, your needs is probably pretty important. So I think you should.
All right, that'll be going out then.
Yeah. All right, Michelle, did you have anything to add on the risk management side for our members?
Thank you for the opportunity. I do have 2 consultants that I've asked to join us today that I asked for them to think about a couple of risk management tips to share with the group. And I'll start with Carol Marshall. Carol, what risk management tips do you have to share with the LeadingAge members? You'll have to unmute.
Oh, I'm sorry. I'm unmuted.
You sound very soft. I'm going to move on to Diana Patton while you turn up your volume. Diana Patton is another consultant that we have joining us today, and Diana has taken a number of calls from members that have had situations arise, and I know that she's got some experience with some risk management tips that she's handed out.
Hi there. Yes, I did want to let several of you know a lot of the questions that I have gotten recently regard residents leaving and going away from the community, either for short term or if they want to, you know, go for an extended period to their family's home. How do we handle that? And the best tools still that we can utilize are from AHCA and CAL, and really just identifying what those risks are for members in the community, because we certainly don't want to present that they absolutely cannot go somewhere, but we are going to hold them to, if they do go, we, you know, if it's an assisted living or an independent, we may be able to have them come back, but they would have to quarantine and they would have to wear masks in the community, and they're putting people at risk. If they choose not to do that upon return, at that point, we can look at affecting our discharging, and that would be when we would want to make sure that we've done that. But we would also let them know that we would continue to work with the ombudsman, work with anyone who is a part of this public health to make sure that we're protecting the main residents. I know that several people will want to get their hair done. The guidance is still that we don't want to have people coming into the community, especially around seniors, to be able to do all of that. And so I know a lot of communities had their staff doing some different things and to be able to help the residents to feel and look their best. I think all of us have been doing different hairstyles, and I know, you know, hair is important. Those types of things are important, but I think it's still important that we just make sure that we're not moving too quickly. I know a lot of people are having phased information. So again, as Michelle was talking earlier, making sure that in addition to your family members knowing when and how the testing is going to occur, making sure that they are aware of how you are planning to open your community if and when you do, what guidance you're following, what you're looking at, because we want to make sure that we're not getting that pressure to go too quickly, because that is not what we've done. I did see there were some people that had volunteers who came and they've still been doing things on the outside of the communities. And so that is something that we're going to want to continue to look at to see how we can have our volunteers do things. I spoke with another community yesterday, and they have their volunteers participating and helping to send cards. So that is still valuable and valid. And so however we can continue to be creative at this time, that's going to be important. Carol asked, Carol put her tip into the chat for everyone. So
Okay.
it says testing employees every, hold on, my screen just went dark. Every 14 days, and announce it to families, and be sure to post job openings with the Texas Workforce Commission. And then New York received an influx of healthcare workers when they asked for staff to come. Mayors could do the same thing for our cities. So I know that there had been some questions about how people were going to manage staffing if people did test positive. And Texas did adopt the approval for the waiver for the nurse aid training. So that is something that is not perfect, but certainly when we have a lot of people who've been in other service industries, that is something that we can draw from as well, to be able to make sure that we too are taking advantage of folks who may be able to help us if we do have different staffing needs. Also looking and revising and modifying some of your staffing plans that you have for your emergency plans, and really looking at putting them into effect if something should occur.
Thank you, Diana. I wanted to add another tip that that Carol sent out earlier, which is for those of you who, and all of you, should be screening your employees as they come on to work their shift. Make sure that they are physically distancing as well as they're waiting to be tested. If you've got, 20, 30 people coming in at once starting a shift, there should be an outdoor area where they can physically distance while they're waiting to be screened on the way in.
Okay, well, thank you, Michelle. I think we're running to the end of our time. For the RRG folks, if you can stay on, we're going to have a meeting after this. For others, we thank you for coming, and we'll be back again next week. We're going to also have a C-suite call this Thursday afternoon. And I also, again, reposted in the chat box to make sure you register for the virtual conference a week from Thursday. So thank you all for participating, and we'll see you next time.